Alive and Well is brought to you by Pine Rest Christian Mental Health Services.
This segment is sponsored by Pine Rest. When someone is having a baby, most of us envision a happy time filled with excitement and joy. However, for many parents, this is not a reality. Sarah DeYoung is a social worker with Pine Rest Christian Mental Health Services, here to talk about the #1 complication of pregnancy, perinatal mood and anxiety disorders. It's good to have you here.
Thank you for having me.
When I thought of #1, this did not come to mind, but explain what you mean by perinatal mood and anxiety disorders.
Yeah, so that includes any sort of anxiety or depression that can occur from the time of conception through 1 year postpartum after baby's birth. And it is, like you said, the #1 complication in impacting 1 in 5 moms and then 1 in 10 partners as well.
The partners, you mean well, let's talk symptoms first and then you can answer this. What are
Sure.
the symptoms?
So the symptoms can include loss of interest in pleasurable activities, excessive worry about baby's health, sometimes having really scary thoughts of, what happens if these things happen to my baby, chronic fatigue, difficulties eating or sleeping. There's also the idea of the baby blues, which can be, that typical periods of sadness and moodiness, but the overall emotion you're going to experience with baby blues is happiness, and it's really only about 3 weeks, whereas something like postpartum depression and anxiety you would experience for longer than 3 weeks.
So the partner piece of it,
Sure.
Are they experiencing the same symptoms or are they coping with their partner who is experiencing the symptoms? Do you know what I mean?
Yes, it can be either one.
Oh.
Coping with those symptoms puts them in a really difficult spot because, like you said, it's not what they expected, and so they're sometimes not exactly sure how to help their partner, but partners can also experience their own postpartum depression and anxiety, even if they weren't the ones carrying the baby.
That is fascinating. Let's talk about risk factors and
Sure.
whether there are some women who are more prone to have, you call it PMAD, right?
I do, yeah.
Yeah.
Risk factors can include any sort of history of mental health and then, or trauma too. Certain medical conditions too, like thyroid imbalances or endocrine disorders. Abrupt discontinuation of breastfeeding too, because that will trigger a pretty quick release of hormones. Other risk factors can include risks in pregnancy, such as infertility, an unwanted or unplanned pregnancy, miscarriage, or infant loss as well.
I'm guessing that it takes a while to figure out that you need to seek help, because first you say baby blues and then it goes for a while and then you think about, oh my gosh, this doesn't feel normal to me. When do you seek help?
Right, and that's a good point. I think there's this understanding that you're supposed to experience baby blues. You're supposed to be all, hormonal and emotional. I think if you feel like those baby blues just aren't going away, if you feel like some of the symptoms we've discussed, you have a hunch that you may be experiencing some of these, then that's the time to seek help. Certainly, I think parenting is just a really difficult phase and it's a big thing to adjust to. And so I think really any time is a great time to seek help. If you feel like talking to somebody about this would be helpful, then reach out.
So what does treatment look like? What does Pine Rest offer?
Yeah, Pine Rest offers a few different options for treatment. We have individual therapy, and you can do that through any of our clinics throughout West Michigan. And then we also offer virtual therapy as well, which can be really helpful if you have some anxiety about parting with baby, so then you're able to stay in the comfort of your own home. We also offer the Psychiatric Urgent Care Center, and that is for more of the immediate assessment or treatment for some of those acute symptoms. And then Pine Rest also is home to the Mother-Baby program, which is one of only a few in the nation. So we're really proud to have that in our agency, and that is a partial hospitalization program where moms can go starting in the morning and throughout the day, just to do some groups with some peers. Like it's very specialized to that perinatal phase. And the unique part about this too is that you can bring baby up to 9 months of age, and we offer the nursery there as well to kind of provide care so you can focus on your mental health.
Very nice, and no, you are not alone. If you
Yeah.
can find more information, you can about PMAD at pinerest.org/PMAD. Good to have you here.
Thank you so much.